Hello and welcome to the first video in a three-part series on primary CNS tumors. In this series, we'll be going through the most common types of primary brain tumors seen in adults. The first of these will be astrocytoma, and in subsequent videos, I'll go through meningiomas and acoustic neuromas. Now before I begin, we're going to go through the etiology of these primary brain tumors. To be honest, little is known about the etiology. What we do know is that there are certain genetic mutations which can predispose an individual to developing these kind of tumors. These would include Li-Fraumeni syndrome, neurofibromatosis type 1, Turkish disease, tuberous sclerosis, and so on and so forth. We also know that radiation of the scalp in childhood can increase the risk of developing these primary brain tumors later on in life. What we have here is a picture of pielocystic astrocytoma. Astrocytomas can be divided according to their grade. There are 4 grades, grade 1 being the least malignant and grade 4 being the most malignant. Pielocystic astrocytoma is a grade 1 astrocytoma, which means that it behaves a lot like a benign cyst. It affects primarily children and young adults and typically arises in the cerebellum or the brainstem. In terms of prognosis, pielocystic astrocytomas generally have a very good prognosis, and in most cases, patients can be completely cured through surgical resection. I'm now going to just skip grade 2 and grade 3 astrocytomas in the interest of time, although what you should know is that among the lower grade astrocytomas, grade 1 astrocytomas are the least common, and the most common is grade 2. Glioblastoma multiforme is a high-grade astrocytoma. It is a grade 4. Now what we have here is a CT scan of a patient with glioblastoma, and as you can see, there's a focal lesion in the left cerebral hemisphere that is surrounded by a halo of lower density edema. This commonly occurs in brain tumors because brain tumors can often disrupt the blood-brain barrier and result in vasogenic edema. You can also see sulcal effacements right here and over here, and you can also appreciate a slight deviation of the falx cerebri as a result of the mass effect. In terms of signs and symptoms, common ones include headaches, seizures, focal deficits, and of course, raised intracranial pressures. Now, as clinicians, you should always remember that patients don't always have headaches. In fact, in glioblastoma multiforme, seizures and slowly progressive focal deficits are much more common. You should also always keep an eye out for signs of raised intracranial pressure, and these would include dilated pupils, papilledema, nausea, and vomiting. This is an image of a patient with uncal herniation secondary to raised intracranial pressure. As you can see, the patient's left pupil is much more dilated than the patient's right pupil, and this is because of compression of the third cranial nerve. In terms of histology, there are 3 distinct characteristics in glioblastoma multiforme. The first of these will be necrosis, which you can see are the eosinophilic areas. The second of these is what we call palisading nuclei, and these are nuclei which surround these areas of necrosis, like a wall or a fence. You can also see vascular proliferation. In terms of treatment and prognosis, glioblastoma multiforme has a very poor prognosis. We're talking about, on average, a less than 1 year survival rate. And in terms of management, it usually includes radiation and chemotherapy. Surgery can also be an option, although that is extremely rare because of the nature of this tumor and how aggressive it is and how rapidly it divides. So that concludes our section on astrocytomas. If you have any questions, just leave them in the comment section below and we'll get back to you as soon as we can. Thank you.